Histology of respiratory system, pulmonary arteriole, blood flow, capillary network of the surface of the alveolus, blood flow, pulmonary venule. This is the unit of exchange gases. Pulmonary arteriole, pulmonary venule. Here the capillary network of the surface of the alveolus. Function of respiratory system: get air into and out of the body and allows gas exchange. Conducting portion: nasal cavity, nasopharynx, larynx, trachea, bronchi, bronchiole, terminal bronchioles, warm, moisten air, warms and moisten the air. Respiratory portion: respiratory bronchiole, alveolar duct and the alveoli. Gas exchange occur. Main division of the respiratory tract: here the trachea, the primary bronchus, the secondary bronchus, bronchiole, terminal bronchiole, alveolar sac. Layers of the wall: mucosa, epithelium, lamina propria, smooth muscles, submucosa, dense irregular CT, glands often present, adventitia. Respiratory epithelium in the conducting portion: ciliated columnar cells, mucous goblet cells, brush cells, sensory receptors, basal cells, generative stem cell that replace other cells, small granule cells produce biogenic amines, paracrine and cells. Respiratory epithelium: ciliated cells, respiratory epithelium, ciliated cell, goblet cell, mucus production, connective tissue, ciliated columnar cells, cilia, basal bodies, junctional complex, mitochondria. Surface of the respiratory mucosa: goblet cells, ciliated cells, brush cells, small granules, electron micrograph of cell of the diffuse neuroendocrine system, or the accumulation of secretory granules in the basal region of the cell. It's a Golgi complex seen in the upper part of the micrograph shows some secretory granules. Turbinate, nasal passage. Here the sagittal section in the skull. Turbinate, nasopharynx, pharynx, nasal cavity, nasal bone, nasal cavity, vestibular, outer nasal area, keratinized epithelium, transition to the respiratory, short hair filter, nasal fossa, respiratory epithelium, swell bodies, counter current flow to warm air, olfactory epithelium, nasal mucosa epithelium, mucus gland of lamina propria, serous gland of lamina propria, thin walled granules, olfactory mucosa. Here the olfactory cells, support cells, Bowman's gland, axons, sinus, frontal sinus, isthmus, sigmoidal sinus, the maxillary sinus. Epithelial lining of the sinus: thinner respiratory epithelium that contain few goblet cells. Respiratory system: here the larynx, trachea, left superior lobe, left inferior lobe, right primary bronchus, secondary bronchus, tertiary bronchus, terminal bronchus, right inferior lobe. Respiratory system: larynx, trachea, left superior, left inferior, right superior, right primary, secondary bronchus, tertiary bronchus, terminal bronchus. Epiglottis cartilage, hyoid bone, thyroid cartilage, cricoid cartilage, trachea, hyoid bone, epigenetic cartilage, corniculate cartilage, arytenoid cartilage, trachea, larynx, trachea, lumen of the trachea, hyaline cartilage, ciliated epithelium, smooth muscle, and connective tissue. Trachea, pseudo-stratified epithelium, pseudo-stratified ciliated cells and the mucous globulus cells are the two major components of the epithelium. Cilia beat at 1000 to 1500 cycles per minute, resulting in movement of the mucous blanket at 0.5 to 1 millimeter per minute in a small airway and 5 to 20 millimeter per minute in the trachea and the main bronchi. Pseudo-stratified ciliated cells and mucous goblet cells are the two major components of the epithelium. Cilia beat at 1000 to 1500 cycles per minute, resulting in movement of the mucous blanket at 0.5 to 1 millimeter per minute in small airway and 5 to 20 millimeter per minute in trachea and main bronchi. Trachea, X14 under the microscope, the high power, the nucleus and the trachea, the goblet cells, viscous mucus, connective tissue, serous gland, fluid secretion, precordium, cartilage, mucous gland in upper respiratory tract, trachea, X10, low power, trachea, low power, gland of trachea, high power,